Hey there, fellow medical microbiologists.
Hi, everyone.
Ever wish you had a really streamlined algorithm for urinary analysis in your lab?
Oh, yeah.
One that's like super efficient?
Totally.
Well, we hear you.
Yeah.
We get it. So, we dove deep into this fascinating AI-generated document,
Oh, cool.
and it's all about urinary analysis in the medical bacteriology lab.
Awesome.
It's kind of like having a virtual expert
Uh-huh.
guiding you through every single step.
That's really neat.
Yeah.
So what's really cool about this document is that it's like a blueprint
Right.
for like a real-world lab.
Exactly.
It covers everything from the moment a urine sample arrives to the final report,
Oh,
and even long-term storage.
is comprehensive.
It is, right.
So we're talking receiving, microscopy,
Uh-huh.
culture,
Oh, wow.
evaluation, identification and testing, reporting, archiving,
Goodness.
even sensitivity testing, workup, referral, reporting,
Yeah.
case examples, exam questions, and even a section for feedback.
That's really cool.
Yeah, the scope is really impressive, right?
It is, yeah.
And it really dives into the nitty-gritty of how to tackle urine analysis with this, laser focus on UTIs.
Really?
Yeah, and it also encourages feedback.
Oh, nice.
So it's like a constantly evolving resource.
That's pretty neat.
Okay, let's zoom in on one of the most intriguing parts of this document.
Okay.
It highlights this technique
Uh-huh.
used in Dutch labs
Oh, wow.
called the Q-score.
Q-score.
Yeah, have you heard of that?
I have not, no.
So it's this quick assessment using a 10x objective lens
Okay.
to determine if a urine sample actually needs a full workup or not.
Interesting.
I'm curious, have you ever used this Q-score method in your lab?
I haven't used it personally, but the concept is brilliant. It's all about, efficiency
Yeah,
and making sure you're focusing your resources where they matter most.
I like that.
The Q-score helps you to quickly differentiate between contamination from skin flora and a true urinary tract infection.
So it's like a triage system for urine samples.
Exactly.
Can you tell me a little bit more about how this Q-score actually works?
Sure.
What are we looking for under the microscope?
So think of it this way.
Okay.
You're looking for two main cell types under the microscope.
Okay.
Squamous epithelial cells, which are usually from the skin,
Yeah.
and leukocytes
Okay.
are white blood cell warriors.
Oh.
If you see a high ratio of squamous epithelial cells to leukocytes, it raises a red flag for potential contamination.
Interesting.
But if leukocytes are more abundant, it points toward a possible UTI.
So it's like a quick check to see if the bacteria are like invaders
Right?
from the urinary tract
Exactly.
or just like harmless hitchhikers from the skin.
Totally.
I got you.
And based on that Q-score, the Dutch protocol suggests this more targeted approach to culturing.
Okay.
So if contamination is suspected, you might not need to do a full culture workup,
Interesting.
saving time and resources.
That's pretty clever.
It is, right?
I can see how that would streamline things. But isn't there a risk of missing a true infection if you're not culturing every single sample?
That's a valid concern.
Yeah.
And the document addresses it head on.
Okay, go.
Even if the Q-score suggests contamination,
Yeah.
they still emphasize the importance of performing a gram stain.
Ah, the good old gram stain.
I know, right?
A classic for a reason.
Totally.
But how does the gram stain, fit into this algorithm?
So the gram stain gives you a visual snapshot of the bacteria present.
Yeah.
You can see their shape, their arrangement, and most importantly, whether they're gram positive or gram negative.
Yeah.
And this information can help guide your next steps,
Okay.
especially when choosing which agar plates to use for culture.
So the Q-score helps you decide if a culture is needed at all.
Right.
And then the gram stain helps you narrow down the suspects,
Exactly.
guiding you toward the most appropriate culture media.
Right.
It's a powerful combination.
It is.
And this brings us to the next step in the algorithm.
Yes.
Choosing the right agar plates for your culture.
Okay.
And it sounds like the Dutch protocol takes a pretty selective approach to this, right?
I do, yeah.
No need to throw everything but the kitchen sink at every sample.
Right.
So they really emphasize choosing agar plates based on those initial findings from the Q-score and gram stain.
Right.
So, for example, if your gram stain shows gram-negative rods and you suspect a UTI, McConkey agar would be a good choice
It would.
because it selects for gram-negative bacteria and differentiates lactose fermenters,
Right.
which can be really helpful for identifying like those common urinary pathogens.
Exactly.
So it's like using a targeted approach instead of casting a wide net.
Yeah.
Right. You're focusing your resources on the most likely culprits.
Right. Exactly.
And this selective approach not only saves resources, but it also helps prevent overgrowth by normal flora,
Totally.
which can sometimes mask the presence of true pathogens.
Yes.
So we've talked about using the Q-score and gram stain
Yes.
to guide our culture process. And it sounds like incredibly efficient.
It is.
But what happens once we do get growth on our plates?
Yeah, good question.
How does this document walk us through identification and testing?
That's where it gets even more interesting.
Oh.
So this document dives deep into species-specific testing methods,
Okay.
going beyond like the basics.
Oh, cool.
For instance, there's a whole section on handling those more challenging organisms,
Okay.
like those producing ESPL
ESBL. Okay.
and carbapinimus,
Okay.
enzymes that make them resistant to important antibiotics.
Well, back up a second. Could you explain those enzymes
Yeah.
for our listeners who might not be as familiar with them?
Of course. So ESBL and carbapinamase are enzymes that certain bacteria can produce,
Okay.
and they basically break down antibiotics,
Oh, no.
making them ineffective.
So that means infections caused by these bacteria are a lot harder to treat.
They are, yes.
So they're like the ultimate antibiotic evader.
Right, exactly.
No wonder there are specific guidelines for handling them.
I know, right?
And they even have specific guidance for LRSA,
They do, yeah.
another tricky bacterium.
Mm-hmm.
But what's fascinating is that they actually acknowledge the limitations of automated systems.
Oh, really?
Yeah, like the VTech 2.
Oh, interesting.
And they emphasize the importance of additional testing in certain cases to confirm resistance.
Wow.
You know, that really stood out to me too.
Yeah.
It's a good reminder that even with like sophisticated technology, careful observation and like good old-fashioned microbiology knowledge are still absolutely crucial.
I agree. Absolutely.
And the document even provides specific examples.
Oh, perfect.
So, for instance, it points out that the VTech 2 might not accurately detect resistance
Okay.
to nitrofurantoin
Okay.
in Staphylococcus saprophyticus,
Interesting.
a common culprit in UTIs.
Right.
So you might need to use a different method,
Oh,
like an e-test,
okay.
to confirm resistance.
It's like they're saying, hey, trust but verify.
Exactly. And this attention to detail,
Yeah.
even when it comes to the limitations of technology,
Right.
is what makes this document so valuable.
I agree. All right, so we've walked through the steps of receiving, microscopy, culture, evaluation, and even touched on some of the complexities of identification and testing.
Right.
It's already a pretty comprehensive algorithm,
It is.
but there's more, right?
Yeah.
What about reporting these findings and archiving samples?
Yes.
Does the document cover those aspects too?
You bet it does.
And these sections reveal a forward-thinking approach that I think you'll find quite insightful.
Oh, cool.
Stay tuned because we'll dive into those details in the next part of our deep dive.
Okay. Medical microbiologist, you heard it here.
Yes.
Don't go anywhere.
Stay with us.
We'll be right back with more insights from this amazing AI-generated document on urinary analysis.
Absolutely.
Get ready for some eye-opening revelations on reporting and archiving.
It's going to be good. Welcome back to our deep dive into the world of urinary analysis.
I'm so glad you're back with us.
Me too.
In part 1, we uncovered some really clever techniques,
Yeah.
like the Q-score,
Uh-huh.
and we talked about how to choose the right culture media
Yes.
based on gram stain results.
Exactly.
It's all about efficiency and accuracy,
It is.
making sure we're not wasting resources
Right.
and that we're targeting the right bacteria.
Absolutely.
And now, as promised,
Yes.
we're going to explore those intriguing sections on reporting and archiving that you mentioned.
Sounds good.
These aspects sometimes get overlooked,
They do.
but they're so crucial for good laboratory practice
They are.
and patient care.
You're right. They are.
And this document really shines a light on their importance.
It does.
So let's start with reporting.
Okay.
Clear, concise communication between the lab and clinicians
Yes.
is absolutely essential for guiding treatment decisions.
Couldn't agree more.
It's like that saying,
What's that?
The right information at the right time can make all the difference.
You're so true.
And the document emphasizes providing clinically relevant information.
Yes.
Not just a list of bacteria found.
Right.
For example, it suggests including information about antibiotic susceptibilities, especially for those tricky resistant organisms we talked about earlier.
Exactly.
So instead of just saying, we found E. coli, you'd also report which antibiotics it's susceptible to.
Right.
Which would help the clinician choose the most effective treatment.
Precise. And they also recommend including comments about possible contamination.
Oh.
Based on those initial findings from the Q-score and gram stain.
Interesting.
This can help clinicians interpret the results in context and make informed decisions.
It's like providing a complete picture.
It is.
Not just a snapshot.
Exactly.
I like that. It feels very patient-centered.
It is.
And this brings us to archiving.
Yes.
Which is another area where this document offers some really insightful guidance.
It does.
Okay, archiving.
All right.
I'll admit.
What?
Sometimes those sample storage guidelines can feel a bit mysterious.
They can.
Like, how long do we really need to keep these things?
Right.
Right.
It's a question we've all probably asked ourselves at some point.
Totally.
But this document lays it all out.
Okay.
Providing specific storage times for different types of specimens.
That sounds incredibly helpful.
It is.
So spill the beans.
Okay.
What are some of the key takeaways from the archiving section? What stood out to you?
Well, one of the most important points is that archiving isn't just about following rules.
Oh, okay.
It's about having a backup plan.
Right.
Ensuring that samples are available for future testing if needed.
I like that.
Imagine a scenario where a patient has a recurrent UTI.
Okay.
And the clinician wants to compare the bacteria from the current infection to those from a previous one to see if there have been any changes in resistance patterns.
Having access to those archive samples could be incredibly valuable in that situation.
It would.
It's like having a historical record of the infection.
Exactly.
And the document provides specific recommendations for how long to store different types of samples.
It does.
So for routine urine cultures, they suggest storage for 3 days at 4 degrees Celsius.
Okay.
3 days.
Yeah.
That seems pretty short.
Is it?
Is that really enough time?
For the vast majority of routine urine cultures, yes.
Okay.
The critical information is usually obtained within that initial culture period. Of course, there might be exceptions, like if unusual organisms are found, or if there are special circumstances surrounding the case.
So it's a good guideline.
It is.
But there's always room for flexibility.
Right.
Based on the specific situation.
Exactly.
And for other types of specimens, like biopsies, cerebrospinal fluid, or heart valves, the recommendations are quite different.
They are.
Oh.
Yeah. So for those more specialized specimens, the recommended storage time is much longer.
Oh, wow.
3 months at -70 degrees Celsius.
Wow, that's quite a difference.
It is.
Why such a long storage time for those?
Well, those types of samples are often associated with more serious infections.
Oh, okay.
And the information they contain can be crucial for a longer period.
I see.
Yeah.
Like recognizing that those samples hold valuable clues that might be needed for a more extended investigation.
Precisely.
And it highlights a crucial point. Archiving is not just about the present. It's about thinking ahead.
Right.
And ensuring that we have access to the information we might need in the future.
I agree.
It's like we're contributing to a medical time capsule.
I like that.
Preserving pieces of the puzzle that could be crucial for solving future diagnostic challenges.
I love that analogy.
And, you know, this meticulous approach to reporting and archiving, coupled with that emphasis on the Q-score and gram stain we talked about earlier, really paints a picture of a well-designed, efficient system.
It does.
It does.
Yeah.
It's like they've thought of every step in the process.
They have.
From ensuring clear communication with clinicians to preserving those valuable samples for the future.
Absolutely.
But you know what else I find really impressive?
What's that?
The fact that they're not presenting this as the be-all and end-all of urinary analysis protocols.
Right.
They actually encourage feedback.
They do.
You're right. Yeah. They specifically ask for feedback from users, recognizing that this is a dynamic field.
It is.
And that there's always room for improvement.
Always.
And that's what makes this document so refreshing.
It is.
It's not just a static set of rules.
Right.
It's a living guide.
Yes.
A framework that can evolve and adapt as we learn more and as technology advances.
I couldn't agree more.
It's a testament to the fact that even with AI-generated guidance, human expertise and collaboration are still essential for driving progress in medical microbiology.
Absolutely.
Absolutely.
And speaking of driving progress,
yes,
we're not done yet. There's one more piece of this intriguing algorithm that we need to explore.
Right.
The nuances of handling those tricky organisms and the importance of understanding the limitations of automation.
Sounds good.
Stay tuned, medical microbiologists, because in Part 3, we'll delve into those fascinating details, uncovering even more insights from this remarkable AI-generated document.
Welcome back to the final part of our deep dive into the world of urinary analysis.
We've journeyed from that initial Q-score assessment all the way through reporting and archiving.
And now, for the grand finale, we're going to explore those nuanced details of the Dutch protocols that we promised.
Right.
It's like opening up their treasure chest of advanced techniques.
I like that.
Get ready for some eye-opening insights.
Okay.
Especially when it comes to those challenging organisms.
Right.
And understanding the limitations of automation.
Absolutely.
You know, one thing that really impressed me about this document was its emphasis on species-specific testing methods. It's not just like a one-size-fits-all approach.
Right.
They really tailor the testing
to
the specific bacteria they're dealing with.
Exactly. And this is where experience and expertise really shine through.
Oh, yeah.
For instance, they have very specific guidance for handling ESBL and carbapenemase-producing organisms, as well as MRSA.
Wow.
These are some of the toughest bugs we encounter in the lab.
They are.
And having clear protocols for detecting and confirming resistance is essential.
It's like having a specialized playbook for each of those notorious superbugs.
Exactly.
And they don't shy away from acknowledging that even our sophisticated automated systems like the Vitek 2 have their limitations.
Yeah.
There are situations where you need to go beyond those automated results and perform additional testing to get the full picture.
Totally.
I love that they call out those limitations.
I do too.
It's a reminder that we can't just blindly trust the machines.
Right. Exactly.
You know,
yeah.
We need to use our knowledge and judgment to interpret those results and know when to dig a little deeper.
For example, the document specifically mentions that Vitek 2 might not always accurately detect resistance to certain antibiotics. Like nitrofurantoin in Staphylococcus saprophyticus or colistin in some gram-negative bacteria.
So in those cases, what do they recommend?
Yeah.
Back to the, good old-fashioned techniques.
Sometimes, yeah. They might suggest using alternative methods.
Right.
Like disk diffusion or e-tests.
Right.
To confirm those tricky resistance patterns. It's a beautiful blend of cutting-edge technology and those traditional microbiology methods that have stood the test of time.
It's like they're saying, use the amazing tools you have, but always be ready to roll up your sleeves and get back to the fundamentals if needed.
Exactly.
Right. And that's what makes this field so fascinating.
It is.
It's a constant dance between innovation and those tried and true methods that have served us so well for decades.
Absolutely. And it's that adaptability that makes microbiology so captivating.
Right.
Yeah.
We're always learning.
Right.
We're always refining our techniques.
Yeah.
Always striving to stay one step ahead of those ever-evolving microbes.
And that's what we hope you'll take away from this deep dive. It's not just about memorizing protocols. It's about understanding the why behind them, the reasoning, the science, so you can apply that knowledge in a dynamic and ever-changing environment.
So as you go back to your labs, armed with these insights from the Dutch protocols, we encourage you to think critically.
Yes.
Don't be afraid to question assumptions, double-check those results.
Right.
And seek out additional testing when needed.
Absolutely.
Because at the end of the day, it's all about providing accurate and timely results that will guide those crucial treatment decisions and ultimately improve patient outcomes.
I agree.
Well, there you have it, fellow medical microbiologists. We've explored the ins and outs of this incredible AI-generated document. From the Q-score and gram stain to the nuances of reporting, archiving, and tackling those tricky organisms.
We've seen how a well-designed algorithm can streamline workflows, enhance accuracy, and ultimately improve patient care.
So remember, the quest for knowledge never ends. Keep exploring, keep questioning, and keep pushing the boundaries of what's possible in the amazing field of medical microbiology.
And if you ever find yourself needing a refresher, you know where to find us.
That's right.